Good evening, all. I'm Dr. Jaya. I'm a consultant interventional nephrologist practicing in SIMS Hospital, Chennai, Tamil Nadu. I welcome you all to this discussion. So if you look at this page, this Speak Health, if you just scroll down the page, you would come across several wonderful lectures by lots of eminent doctors across the state. They're doing a great job. So I would like to thank the Speak Health group as well as the Sun Pharma people for giving me this opportunity. Since the audience are pan-India, we will continue to have the conversation in English for the next 30 minutes. So where do we stand in terms of this COVID pandemic? We have hit a peak. Some of the states are starting to flatten the curve as well. In Tamil Nadu, things are slightly getting better. We are seeing some light at the end of the tunnel, but still it's a long way to go. So what have we realized over the past 1.5 years is our understanding of the disease has evolved significantly. So what we initially thought that is a disorder that is restricted to the respiratory system and the clotting system. Right now, we know that it is not like that. It's in fact, COVID infection is a systemic disease. It can affect any organ of the body, which means the kidneys are no exception as well. And so over the next 15 to 20 minutes or so, we will have a discussion on this topic, managing kidney patients in the current scenario. So back here in Chennai, in the place where I practice, we have around 200 patients undergoing dialysis in our unit. There are more than 1,000 people on our OPD follow, which includes almost 150 to 200 transplant patients. So what has happened over the past couple of months is we have gained significant insight into the nature of the disease, how it behaves in these kidney patients, and how we can go about their management, not just the COVID management, but the other issues as well, the logistical issues they are facing, the practical difficulties they are enduring during this COVID pandemic. Each and everything we have been experiencing firsthand. So I would like to share some of my thoughts over this particular topic. So this conversation is totally going to be from a patient's perspective. In fact, it is an interactive session. The comment section is open, so you can put forward your queries and the questions, which will be answered at the end of the talk. And my own talk is also going to be basically based on the questions that the patients, my own patients, have put forward to me. So it's not, and with a little bit of scientific rationale. It's not going to be an entirely a scientific talk. It is totally going to be from a patient's perspective. So with that, we will move on to our topic. So when I say COVID and kidney, what we have to remember is it's a two-way phenomenon. In the fact that a patient who is otherwise normal, who goes on to develop a COVID disease, he might end up developing some kidney disease. So that is the group number one. On the other hand, there are patients who already have established kidney disease who end up developing a COVID infection. So that would be the major chunk, which will be in the group two. So let me tell you briefly about the group one, because those patients also we are starting to come across a lot. So in general, the involvement of the kidneys secondary to a COVID infection will entirely depend upon the severity of the COVID disease. In the mild and the moderate groups generally get away without any major involvement, but then those who have a severe COVID disease and those people who are admitted into ICUs, they have a significant involvement of the kidneys. So this can range, again, the involvement of the kidneys secondary to COVID can range from mild disease, which has to be done nothing, to the extreme form where they might even end up dialysis and so on. So basically, in any hospital, when you get hospitalized for COVID, you will definitely be evaluated for your kidney functions as well. If at any point of time you are identified to have some kind of problem, definitely they will seek a nephrologist's advice and they will continue to treat you for COVID as well as the kidney disease simultaneously. So to this group of people, what I would want to suggest is you people require follow-up even after you have recovered from the COVID. What we are seeing is significant percentage of people are left with some residual dysfunction. In fact, the literature is growing up. We have studies. One of my own colleagues is doing a study here in Chennai, and he has also found out that there is quite significant number of COVID people will end up having minimal kidney dysfunction at least. So how do we benefit? How do we improve these groups? By identifying them at the earliest, which will be done when you are hospitalized. And subsequently, you need to be in follow-up either with your primary physician or a nephrologist if you have been informed or if you have been found to have a kidney disease. So that would be my first suggestion for these patients. So with that, we will move on to the second group, which is the major chunk. So these are the kidney patients or patients who have any form of kidney disease, let it be of any etiology. It could be a stone disease, it could be a glomerular or an interstitial, any form of kidney disease who have an established chronic kidney disease. And these patients going on to develop a COVID infection. So how do we go about them is the second major discussion. I would like to split up this talk over the next 10 or 15 minutes into 3 or 4 categories to be precise. First, we will see about chronic kidney disease patients who are not yet on dialysis. Then we will discuss about the chronic kidney disease patients who are already into dialysis, especially the hemodialysis. What are the do's and don'ts for them? Third, we will discuss about certain special groups, the transplant population and the other certain groups who require special attention. And last but not the least, I would like to discuss about the vaccination in these kidney patients. So this is how I'm going to go about the talk for the rest of the conversation. So let's begin with this first subgroup. So these are the patients who have some form of chronic kidney disease, but they are not yet into dialysis. So in general, lots of precautionary measures have been suggested for the general population. All of these applies to these people as well. Yes, try to be in home, isolated as much as possible. Try avoiding mingling in the crowd. Do wear masks, use sanitizers, and all these general precautionary measures very much applies to you as well. But then what makes you a special group is your immune system is a bit compromised, which means you are prone to acquiring COVID disease. Number two, not just prone to acquiring COVID disease, you might also end up developing complications of this disease, which means you should be extremely cautious. Like for a general population where we directly advise self-triaging for mild disease and self-monitoring in the house, it is not the case for you people. What I would suggest for you people is if you develop symptoms of COVID, any of these symptoms, seek attention of the hospital or your primary physician or a nephrologist straight away. Let them assess you and then let them decide whether a home quarantining is enough for you or further evaluation of hospitalization is required. So that would be point number one. And number two, if you end up getting hospitalized, do make sure that you inform your primary COVID care team, which might not comprise a nephrologist. You please do inform them that you're having some kidney disease because they should be aware of that and they should be able to modify certain drugs and treatments according to your needs. And number three, you require follow-up after recovering from the COVID disease as well. As to why? Because the literature is showing that the patients who are having a milder form of kidney disease end up progressing into a more severe form during this COVID illness. Not just in all the cases, but then the numbers are like 30 to 40% of the people can have some exaggeration of their kidney dysfunction. It is for this reason you require assessment of your kidney disease simultaneously while you are on treatment for your COVID, as well as after you recover your COVID, during which you should follow up with your primary nephrologist or a physician. So that would be the key message for you. Now let's move on to the next group. So the next group are patients who are already on the dialysis, especially hemodialysis. Why we want to talk specifically about this population is, in addition to the fact that they are immunocompromised and they are more prone for COVID infections, these are the people who cannot avoid hospital visits, which means they have to come to the hospital for at least 2 or 3 times in a week, and they have to be in the hospital for their dialysis sessions for at least 4 hours, which means they are definitely at the risk of exposure. And if you have noticed, if you are a kidney disease patient on dialysis, you very much know that any dialysis unit is a centralized air-conditioned unit. You're going to share the unit with your co-patients, which means you are definitely at the risk of acquiring this infection. So let's track how cautious and what are the precautions as a patient on dialysis should do. Let's track a patient right from his house. So you better be in the house unless otherwise required. You don't come out of the house unless otherwise required. But if you are an employee, if you are working somewhere, yes, you might have to go out. You follow all the rules. I would in fact suggest wearing double masks or an N95 mask to be doubly sure that you will not get exposed. Do not touch things that are not essential. Like for example, even during your travel, you identify what is the mode of travel you're going to be, especially with the lockdown in and so other logistical difficulties. You have to identify your mode of transport to ensure that you travel safely to the hospital. Now, once you reach the hospital as well, try avoiding touching the surfaces as much as possible. Yes, fomites are not a big issue in COVID transmission, but then in hospital, there might be patients turnover very rapidly, which means the droplets can still be there. So try avoid touching surfaces as much as possible and use hand sanitizers whenever you have touched soap. Once you reach your dialysis unit, right now, most of the dialysis units have set a protocol. So you will be screened, you will be checked for the temperature. Let's assume you don't have temperature, you don't have any other symptoms, you're allowed into the dialysis unit. The next 4 hours is going to be very, very, very crucial. So you are inside an air-conditioned unit, you're going to lie down and the dialysis personnel is going to come and touch you. So you need to be wearing your mask throughout the procedure. The full 4 hours you should be wearing. Don't lower your guard at any point of time. One practical difficulty is many of our patients will require a meal or so during the dialysis. You might end up having low sugars. So these patients, you will have to adjust to it. You must have a meal before you enter the dialysis unit, or if it becomes inevitable that you want to have a meal or something, try to have a small one. Just have a biscuit or a cup of coffee so that the duration of exposure without mask is kept minimal. So this is significantly important, and it's the same after you finish dialysis as well. Go back home safe. And these precautions of being cautious applies to your attenders as well, because most of our dialysis patients are accompanied by attenders who are going to come and wait outside the dialysis unit or in the car or anywhere for the 4 hours till you finish your dialysis. So these people must also follow all these precautions, because they can very much carry the infection from the hospital all the way back to the house. So these are general precautions that you as dialysis patients might will have to follow, which is very, very crucial. And then this is for patients who have not developed any COVID disease. God forbid, if you end up developing a COVID disease, please do not neglect any symptoms, especially the symptom fatigue. You might overlook, because in general on dialysis days you might feel tired and fatigued, but do not overlook these symptoms. If you are having excessive fatigue, or if you're having even a mild cough or a cold, do seek medical attention, because of the immunocompromised state of these patients. General symptoms might be subtle, like fever might not be obvious to begin with. So these patients will have to be extremely cautious in picking up their symptoms. And if you have any symptoms, do not hesitate one bit. Seek your medical care immediately. Go report to your nephrologist or your dialysis unit. Do inform them that you're having some sort of infections. This is going to be of two benefits. Number one, we will be able to identify you at the earliest and start treatment at the earliest. And number two, you have the moral responsibility of not passing it on to your other co-patients where you're going to share the beds. So for these two reasons, be sure that you are monitoring yourself. If you have any symptoms or any other mild abnormalities from the routine, immediately seek medical attention. Why I'm repeatedly stressing this for this group, whatever the study that we have done or whatever literature that is available, it is this group that is quite vulnerable. The mortality, the death rate among the dialysis patients is slightly on the higher side compared to general population, which means if 100 dialysis patients end up developing COVID, 10 to 15 of them might even end up developing a severe COVID or even succumbing to the disease. So this is something that you should have in mind. You are a vulnerable group. You have to come to the hospital, no other go, but do ensure that you seek medical attention at the earliest as possible. So this is for the second group. And finally, into the third group, this is the special population with kidney disease, like those who have underwent a renal transplant or those who are having certain glomerular diseases, people who basically are already having drugs, the immunosuppressive medications, which means your immunity is already suppressed. So your tendency to clear the virus spontaneously might be significantly lowered, which means you might have to alter your medications. Where does it lead to? Immediately. Whenever you develop symptoms, go to your physician or the nephrologist immediately. As far as the transplant or any of these patients are concerned, the patient's life takes a priority. The graft life comes secondary. So we might even have to alter your immunosuppressive medications, which you people might be very well versed, like the steroids or the other immunosuppressive drugs. We might have to alter them according to the severity of the disease. If you end up having a severe disease, we might even have to withdraw your medications. Thereby, trying to save your life becomes a priority rather than saving the graft. So this is again very, very important. So transplant patients and those patients who are on any other form of immunosuppressants, if you develop any form of disease, there is no role for your self-triaging or your self-monitoring. Please do seek medical attention, especially your nephrologist's help at the earliest as possible. So that will be the third thing. So these are the three groups that we need to be pretty much cautious about. And I think I have addressed some of the common questions that are frequently put forth to me. The next big thing that I would like to convey or clear here is regarding the vaccination. Remember, there are lots of rumors going on around because we are all in touch with this WhatsApp universities and so on. Do remember, most of the messages in such groups are false. Most of the messages are from half-baked people who do not give you right information. Do follow the instructions given by your primary physician, which means I would say vaccination is 100% must in this subgroup, especially the chronic kidney disease patients. Why? Because yes, you are more prone to the disease. You are more vulnerable to the complications of the disease. So, which means you should get vaccinated. So, as far as now, we have two sets of vaccines available. One is the Covishield and the Covaxin. certain groups, Sputnik vaccine is available and certain other vaccines are going to come up. I'm telling you right forward here clearly, all of these vaccines are safe in the kidney patients, including the transplant patients. Now, what we have come across in the studies that are available is these vaccines, they do not produce special kinds of complications or anything in these patients. Maybe they might be less efficacious. They might not be as efficacious as it is in the general population, which means more literature will, in fact, in future, it might even suggest that we might have to give you booster doses also. So how do you prevent from the COVID vaccination is the biggest way to stay away, which means you will have to get vaccinated. Now, as far as CKD patients are concerned, you can get both the vaccines that are available. There are no contraindications. For the patients who are on hemodialysis, avoid the day of vaccine. The day of vaccination should be not on the day of hemodialysis, because you are given heparin. Heparin might lead on to pain and hematoma in the arm. So try getting vaccinated on the days other than the hemodialysis days. That's the only precaution you might have to take up. The side effects associated with vaccines are all very, very minimal, whereas the rumors are all so big. So I just want to break the myth here. Do not follow the rumors. You approach your nephrologist, get vaccinated at the earliest possible whenever. All right, so this is a very important thing that I want to convey as well. And then there were several questions and answers that were frequently put up in the group as well. So I would like to answer them also. So the kidney patients are have weak immune systems. Yes, I think I have told you that. Yes, you people have a weak immune system. You need to be definitely cautious. Kidney disease patients need to be in complete home isolation during this time. Yes, if possible. If possible, try to be in home isolation. But then those who are employed, school and college is closed anyway. So those who are employed and the other people, if you have to go, if not you're working from home, if you have to go, take all these precautions that we have mentioned, get vaccinated at the earliest. Kidney disease patients are at a higher risk of developing complications. Yes, again, we have discussed the complications, the percentage of complications is significantly higher in the patients who are already having an established chronic kidney disease. So be cautious. Vitamins and mineral supplements for boosting immune system are unsafe. No, they're not unsafe, but I would say you continue the diet and the prescription that has been given to you already. Have a nutritious food, have the prescribed amount of water intake that you have been given, take the medications that you are taking. Do not hold any of these medications. Continue to take all the medications that you are taking, even if you get infected with the COVID. And do vitamin supplements. Yes, they do add to some benefit, but there's no harm in taking them. Kidney patients can take Ayurvedic medications, but yeah, this is something again I wanted to stress. In a patient who is established with kidney disease, I would not recommend taking Ayurvedic medications or any other form of Ayush treatment. Of course, there are certain diseases and certain lifestyle practices where this Ayush might be really useful. But as far as a patient with an established kidney disease, and more so in a COVID scenario, I would definitely not recommend you to go ahead with the Ayurvedic medications, simply because right now there is no literature that is available supporting them. Let's follow scientific approach. Let's follow science. So for now, try avoiding any of these medications. Just follow whatever medications you have already been taking and approach the allopathic care for your COVID treatment. Kidney disease patients can exercise at home. Cannot exercise. No, it's a myth. Of course, you can do your exercises. You can continue to exercise and whatever you are doing already. Wearing masks for a longer time is not safe for a kidney disease patient. No, definitely it is a myth. You need to wear masks. It is absolutely essential. In fact, I would suggest a double mask or an N95 mask if you're forced to go out. So that would be it. And finally, vaccination is hazardous in these patients. A big no, a very, very big no. Vaccination is one way we are going to prevent the third or the fourth way to come. That's another way of putting it this. So we have to follow the quarantine rules or whatever it is, and we'll have to get vaccinated at the earliest possible, not just the kidney patients, any general population for that matter of sake. You will have to get vaccinated. In fact, the trials are going on in the pediatric age group as well. Soon there will be literature that is available, and even those population will also have to take the vaccination whenever available. So that would be my monologue. So let's see if you have any other questions that are coming up in the forum. I would be more than happy to address those questions as well. Yes, we have some questions that have come up. I think some I have already added. How to boost the immunity of kidney patients? No, there is nothing specific to boost the immunity of kidney patients. I wouldn't suggest in that way. Just continue to take healthy foods, whatever dietary prescription that has been given, continue to take them. I'm not a big believer of these immune boosters or anything and all. You're all fine and doing well with whatever you are currently on. Do take some supplements, eat nutritious food, adequate amount of liquid that has been prescribed to you. That would be the best way to keep your immune system ready if in case you end up having or coming across a COVID infection. Do I need to skip dialysis before or after taking the vaccine? A big no. Like I said, do not schedule your vaccination day on the day of dialysis. That's the only precaution that you have to take. Try to get it vaccinated one day after the dialysis so that you will be fine by the time you come back to your next dialysis session. There is no need to skip dialysis before or after taking medicine. Do I need to skip medicines before or after taking medicine? Again, a very big no. Now, before you get vaccinated, I'm sure you might come across your nephrologist. There are only certain group of medicines which you need to be cautious. This is called as anticoagulants. Certain kidney disease patients and certain cardiac patients, where majority of the kidney and cardiac patients are together. So there might be certain medications called anticoagulants. So these are the medicines that you need to be cautious if you're going ahead with the vaccination. So if you're on medications, such medications which are supposed to prevent blood clotting in your body, you can approach your cardiologist or a nephrologist. Just ensure your drug label is within the therapeutic range. And if it is in therapeutic range, despite taking that oral anticoagulants, you can go ahead and get your vaccine shot. There is no harm. And in the early part of the disease, there was query about continuing one specific antihypertensive drug, whether it can be used in the COVID scenario or not. Right now, the literature is clear. Even that antihypertensive drug can be continued. So definitely the answer is a big no. You need not skip any medicine before or after medicine or any other medicine that you're taking, even during your COVID infection, except for the immunosuppressive medications, which you will have to approach a nephrologist or a treating physician who might end up deciding whether you will want to continue it or not based on the severity of your COVID disease. So that would be the next question. Do we have any other questions here? All right, I think there is not much of questions left. I think in that group speak health, the video will be still on. You can pass on your comments there. If you have any queries, I would be more than happy to come back and answer your queries as well. But I think for now, if we do not have any much of questions, we'll be closing this session from live transmission. Shall we?